let me show you guys how unique of a class this is. Well, first of all, thank you for coming on live on our virtual, but we've also got my living room. Wave, everybody. I told them to all be quiet. And Jude is crying. My baby's crying. So we actually see we're watching on the big screen too. So I'm just multitasking. I'm really glad to have Dr. Tonya here. Sorry, guys. I'm just going to talk here for a second, and then we'll switch over to Dr. Tonya. But this class was birthed out of just the last month of a lot of sickness going around. A lot of people I love, friends, family, and a lot of children. And I know, Tonya, when you talk about what you do, you see this all the time. But I was just like, man, I want there to be a class where we can just tell people what to stock up on. Because a lot of times, like when you're in the pinch, you can't wait for something to arrive and wait to order it. So you just to know what are the staples that I should have in my home. And this class has now evolved into so much bigger than this. Then I reached out to Tonya, who is a friend of mine, but I've also worked with closely for the past, I want to say 8 years. She has a lot more freedom of speech than I do. And so I'm really thankful that she agreed to do this. And she's just a wealth of knowledge. Um, but a little bit about me, if you don't know me, my name's Haley Aliff. I have 4 kids. I don't say this in a prideful way. It's just a matter of fact that my kids have never seen a doctor. And it's not because I'm not anti-doctor at all. We just haven't had to thankfully need anything like that yet. We've been able to treat everything from home. And that's not to say that we haven't had our fair share of sickness, everything from whatever COVID strains going on, the weird croupy coughs, the ear infections, the fever, the pink eye, you name it. We've treated it all from home. Um, and I am a second generation raising my kids the way that my mom raised me, which was really holistic remedies first and then Western medicine second. And that's what I appreciate. What Tonya brings to the table for me is such a peace of mind, someone that I've always had the confidence to be able to go to when I don't know what to do and when I'm kind of stuck and lost. So, my short story about what she's done for us is that when we adopted our oldest, Emerson, she's 6, not to like get too deep into her personal story, but we knew that she was going to be born with a compromised immune system. We knew that we were going to need to support her gut. She was supposed to be in the NICU for 4 months is what they told us to plan for. And so I had already been working with Tonya for my fertility, and she was like, send me every medical that you can. Every time her birth mom goes to an appointment, send me the report. And by the time Emerson was born, we had a full-blown protocol ready to go to detox her, to help her thrive. I knew exactly what to do every 2 hours, every 3 hours. It was a crazy 3 months. But the miraculous testimony is that we started the protocol on her right away when she was born. Was using a series of essential oils, homeopathics, detox tinctures, probiotics, enzymes. She was out of the NICU in 4 days, and it was such a miracle. And I just attribute so much of that knowledge and confidence that I gained through Dr. Tonya. So I read on your website, Tonya, that you started in 2003. So you've been doing this a long time, but she's a board certified drugless practitioner. She's a mom of 8 humans and 100 animals. That's a lot of people to keep healthy. She's got a background in all sorts of different modalities. Naturopathy, is that the best way to say that? Herbalism, homeopathy, counseling, genomics, functional lab work, and functional medicine. Tonya worked on this presentation. You guys, there's so much information in this. I don't want you to get overwhelmed. If you can just take some nuggets from today, you're going to get so much value out of this class. She's literally covering, I was looking at it, she's going to cover eyes, ears, nose, mouth, throat, lung, heart, stomach, digestive, skin. She's going to cover all these different modalities. And just to help you guys save time, she put all of her notes together for you. So you don't have to take notes. Like, you have access to these slides and the complete list of how to stock your home. So we already have that ready to go. I'll show you how to get that. But just to kind of paint a little picture, and then I'm going to switch it over to her. Oh, there you go. There's your outline for tonight. all sorts of fun things. She's even going to get into in a pinch over the counters and things like that, and some home remedies. Oh, wow. I was so prepared. I forgot I put this in. This is how you can get the presentation and the list. If you want to do this, I'll also put this at the end for anyone jumping on late, but you can just text Dr. Mom to 985-218-8868. And hopefully that works. And that will send you. Y'all got that? Okay. And I have it in other places as well. Okay. So just a little overview of just a picture of American health for you. Over 65% of the population takes at least one drug daily. Over 40% of children have at least one chronic health condition. Over 40% of adults and almost 20% of children are obese in America. 1 in 6 children in America have mental health disorder. More than 24% of American adults are taking a psychiatric medication. Each year, more than 16,000 children are diagnosed with cancer, and that's only in the US. Are y'all seeing my slides change up there?
Yeah.
Okay. Sorry if this was, okay. Okay, I'll go back to that for you. And this is just a toxin in the home stat, but the EPA has reported that nearly 30 cancer-causing chemicals were detected in the fat tissues of literally every American today. That's from things in our home. So this is just a few stats, but the picture is that American health is not really that, it's not really that great. And when you look at just like the standard of healthcare and what we are told to do, mainstream advice, this is the traditional Western medicine route, is to go to the doctor, get vaccines, take medicine to maintain a healthy lifestyle. And a lot of families do that. And it's really the only way we know to keep our kids healthy. But I think a lot of moms, case in point, this room, and everyone on here tonight, we're becoming more aware, more knowledgeable, empowered to look for a different way, maybe even a better way or alternatives. I believe that there's things that we can do that don't have to be complicated or super expensive. And the truth is that avoiding mainstream ideologies like eating preservative-filled products or processed sugar or avoiding antibiotics as a last resort, not making OTCs your regular go-to thing that you grab for, having discernment in your well visits, focusing on whole foods, playing outside, barefoot, getting vitamin D. These are all different ways to support our body's innate function, the bodies that God gave us. And every child's going to get sick, right? This is not, we're not aiming for perfection. In fact, my kids' immune systems grow and learn every time that they get sick. And antibodies and good things can come from that. But we're trying to avoid recurrent sickness, frequent sickness, sickness that lingers so long that you can't figure out how to get to the root of. And so as a mom, I appreciate the fact that there are different practitioners out there. The quick overview. So you've got your MDs, right? Those are your pediatricians or your family practice physicians. They offer routine vaccinations. They do milestone checks, but then they also break off into specialty doctors, right? You've got your dentist, your optometrist, your ENT, your endocrinologist, or gyno. Like they break off into these specialties, right? One of our go-to doctors is a chiropractor. These offer spinal adjustments, x-rays as needed. They can treat ear infections, congestion, constipation. Chiropractic is a great way to support your immune system. Of course, a naturopathic doctor. We have several here locally, but I've worked with Tonya remotely for years and years. And what they do is they get to the root cause of the sickness. So they can usually test or treat for things like food allergies, parasites, mold, virus, bacteria. There's all sorts of ways they do this. There's biofeedback machines, there's saliva samples, urine, stool. So there's several modalities out there, and people that we can choose to work with for our family. The naturopathic doctors, why we choose them first, they abide by 6 principles. First, do no harm. They really hone in on the healing power of nature, which to me, I just call God's medicine, what he's given to us. They identify and treat the causes, which we'll talk about that in a minute. They aren't your doctor so much as they are your teacher. They treat the whole person, physical, emotional, spiritual. And they focus on preventative health, not just like, oh, you're sick, do this, but how can we help you be healthier? How can we help prevent sickness in winter, or give our bodies a fighting chance? There's two types of medicine: conventional and functional. Conventional medicine treats above the surface. So they treat symptoms. They view the body as separate parts, which is why you get different doctors assigned to these different parts. They offer treatments that can work, but also come with side effects and complications. We know that drugs create patients for life. The industry, and I'm not dissing doctors, so don't mishear my heart on that, but the industry in general is profit driven, and it focuses on treating disease, not the patient. It's very limited to drugs and surgery. Functional medicine, on the other hand, focuses on whole body, root cause, plus the environment, plus your lifestyle. I feel like it's the medicine for here and now, for the 21st century. So instead of treating individual diseases, functional medicine looks to heal the underlying dysfunctions present in the body that contribute to each condition. So I'll let Dr. Tonya talk a little bit more about what she does, but for one, I think I have one more slide. If you missed that, I know somebody did because you put it in the chat. Feel free to scan that if that's easier. That's your stock list, that's your class notes. Of course, I can't find my chat now. If it's easier, here, I can go back to the QR code. If it's easier for you, somebody asked for this number again, you can text Dr. Mom to 985-218-8868. And then here, I'll put the QR code back up one more time. Okay, I'm going to turn this over to you and pull your slides up, and I'll make you host so I can mute myself. Thank you guys so much for being here. Did y'all get that QR code? Okay.
Thanks, Haley.
You're welcome. Go ahead. I'm gonna pull up your slides, but you want to intro.
All right. Welcome, everyone. I'm so excited to be here. I love talking and sharing, and a little bit about me. Above what Haley has said in my education is I like to think of myself as really practical, right? Because there are times when you have to do things outside of the box, and that's when you really need that relationship with your naturopath to say, hey, you might think I'm crazy. However, I need you to do this, this, and this, right? And so really stepping back, or sometimes we break the rules, in classical homeopathy, we're going to do like one remedy and we're going to do that, for a series of whatever. But in practical, we're going to do 2 or 3 homeopathics or combinations and things like that at it. So sometimes, depending on what's going on, we may focus more herbally, or we may focus more on homeopathics or supplements or vitamins. And so that's what's so great is that it's really, in my world, everything is so specialized down to the person and circumstance, and that can change. So if you have something today and 6 months from now have something similar, the remedy might be different. And so that's why when you have somebody in your back pocket, you can call them up and say, hey, what's working right now? Like what we're seeing is what I'm giving people in Louisiana for this cold and the fog virus and all this is not necessarily working for what is going on in Tennessee, where I am. And that necessarily isn't working for those in California, even though everybody might be having that same lingering cough. It's not working. And so that's what's so great too, is like I have people all around the world. And so that first 1 or 2 people of whatever the area is and whatever that virus or bug that's going around, I get to kind of, hey, try this, we do whatever. And then you're like, wow, that's not working. Let's do this. And then you repeat that on the second and okay, that's working. But that same scenario may not be working in another area. And when you work with me, we get all up in your business too, right? And so we want to know the details. What does it look like? What does it sound like? What's the color of it? Does it have a smell? So when we ask you to do all these kind of crazy things, it's because we want to know all the details. I'm in Knoxville, Rosie. And so, as Haley's trying to get the slides up and everything, you know, one of the things is you want to have someone like me in your back pocket. You want to have a relationship with someone like me because we don't punch a time clock. We're not Monday through Friday, 9 to 5. We are with you. You know, it's Friday, 5:05. That's when everybody gets sick, right? Especially the kiddos. So you want to have somebody that you can reach out to, that you have that relationship with, or you can build the relationship with. So when it's 9 o'clock at night, you have a number to call and you're going to get somebody. A lot of times people end up in the emergency room and urgent care simply because they don't have someone to walk them through. They're scared. They haven't had it. This is the first time. How far do they let it go? They sometimes just need a cheerleader to say, take a deep breath. It's okay. You got this. You can do this. Let's give it a little bit longer. And that's what we do. We don't rush you to the emergency room. We don't rush you. Yeah, Michelle, yeah. And so it's nice to kind of have that and to know, like, sometimes I'm going to tell you it's going to suck for a couple hours, but I need you to do this. You know that when I'm telling you that, it's okay because I'm here. I'm going to be encouraging you. And it's not just when you're sick, it's when you need to have something preventative or you're going to have a procedure because there's not a herb or a homeopathic that's going to solve your problem. And you might have to go in to get a procedure done in the hospital. So how do you prepare for surgery? How do you detox from the anesthesia? So it's not just, it's a whole big different world that you might not have been exposed to. And we use so many different things. And, when you get the list, I don't want you to be overwhelmed because there's a lot of things on there. And one of the things we're going to talk about is, what is your specific need? Where are you? Do you have kids? What are the ages of the kids? Do you have medical concerns? Where do you live in the country? And then let me help you say, okay, from this list, you probably need these 10 things to start with, right? Because it's all about going slowly, building up your stock, building up your inventory, but you start with what's in your face. And as time goes on, every month, you'll just add another thing or another thing that, you build that up, right? And so it's all about having that relationship to say, okay, here's what my family is. This is what we have going on. And then let someone like me come back and say, okay, here's the 10 things. And this is the priority order for you to get. And so are we ready to go, Haley? I can't.
Oh,
There
good.
you
Did
go.
you unmute me? When I made you the host, it kicked me off as a host. So I either make me back a host. Do you know how to do that?
Will it work if I do the slides from my side?
Yes, or you can just share it on your side. I do think it stopped recording though, so you'll have to click record too.
Okay.
Sorry. You used to be able
That's
to be
okay.
a co.
Give me 1 second and I'll pull everything up. Slideshow. Beginning.
Oh, good. Okay. Madison says it's still recording on her end, so that's good. Oh, I see
It
that too.
shows that we're still recording.
Okay. So yeah, you just did.
All right. Can you see my screen? Haley, can you see? Okay. Awesome. All right. So this is kind of how I keep myself and my animals healthy during cold and flu season. And one of the things that I will give you is a courtesy email. So at the end, you'll get my email address and you can just simply tell me, hey, I'm in Louisiana. What do I need to do for my area? Or I'm in California. What do I need to do for my area? I'll send you back a short little questionnaire like, do you have high blood pressure, whatever? Because we don't want to recommend herbs like, let's say, licorice that can increase blood pressure if you're on a blood pressure medicine, right? So I will give you guys that, okay, at the end. So disclaimer, we're not your medical doctor. This isn't a substitute for medical information, and nothing in this presentation that Haley and I say has been reviewed or evaluated by the FDA. Unfortunately, we have to put that in there to protect all of us. So this is who I am. We've already talked about that. So a couple of things, you guys, when we think about immune compromising, we think about, oh, let's wash our hands, let's, do things like vitamins and nutrients, but there's a lot of things that we don't necessarily talk about. The election is very stressful. That compromises our immune system, a lack of stress, a lack of, the way we can regulate the stress, right? Lack of sleep. We do boredom eating. We've got Thanksgiving. We call it the sugar holidays, right? Thanksgiving and Christmas, New Year, Mardi Gras. It's king cake out there. It gets darker earlier. We're shopping. We have the holidays. There's, money issues. Credit card bills are coming in from Christmas, deficiencies, genetics, all of these things. When we're talking about compromising immune and staying healthy, it's not just about getting sick or not get sick. It's about exposure to radiation, and people who travel and do a lot of flying, they're getting exposed to that radiation in the airport, or EMFs and cell phone towers, and all of those things can compromise our immune system. So we want to make sure that we're looking at a lot of different areas. And so, and take that into consideration, right? And that's something that having a practitioner is going to look at when you get in the alternative world. We're going to look at all those areas. What's going on in your home? What's going on with your children? What's going on with your marriage? What's going on with your parents? Are they aging? Are you having to be a caretaker? All of those things. That's what we want to know. We get all up in it. Okay. So some of the things we're going to talk about today is things in your air, things that you can do topically, diffusers, syrups, home remedies, herbs, homeopathics, tea, over the counter, and different things like that. So we have tons of wellness options that you may or may not be aware of. So when it comes to different parts of the body, I kind of broke it down because I wanted you guys to kind of see that there are so many different things for each part of our body. And when you go to traditional medicine out there, you've got the ophthalmologist, and you've got the gynecologist, and you've got the endocrinologist. And so everything is broken down into different categories. But when you come here, we are all inclusive in this. So when we think about the eyes, we want to make sure we have something for the eyes on hand, whether that's a saline or an ointment over the counter, things to hydrate the eyes, a wash kit in case you get something in there, or something you can do for an infection, essential oils, which ones you can and can't use around the eye. We typically say we want to stay out of the eye orbit unless it's specifically made for the eye orbit area. So there's different herbs we can use, homeopathics, and even blue light filtering glasses, right? If you're going to be on a computer, you got your kids on the tablet, we all should be doing blue light filtering glasses, okay? Something we don't necessarily think about when we're looking at help for our body is protecting our eyes, right? Talking about ears. So, we want to have things for an ear infection and for pain. One of the worst pains is an ear infection, right? Pain in your ear. It's just really, really painful compared to other things. And we want to have a thing like an otoscope with a camera so that you have this little device. You can look in the ear, you can take a picture, you can send that to your naturopath. You can even, some doctors even have that feature that you can actually send it to a regular medical doctor or your pediatrician. We want to know what essential oils that can go in our ear, garlic oils, and what type of silver is best for the ear, what herbs, homeopathics over the counter. And so all of these different things, when we're thinking about different body parts, and also, can we get one thing that's going to work in multiple body parts instead of, oh, this is my ear pile and this is my eye pile. We want to try to get as many uses out of one product as possible. Okay. So let's look at nose. So when we things, for our nose, we want to have nose sprays or different kinds of things for our nose. And I'm going to show you some of the things that I have here. I've got on my desk, I have a lot of things laid out here. I'm going to show you some of the tools I have. You want to even have like a glass bowl or a stainless steel pot, because we want to be able to perhaps, to old fashioned, right? You boil some water, you put your head over it, you put a towel over. So even those kinds of things are going to be beneficial in this case. What herbs and different things as well, when we're looking at for our nose, what can we do there and how can we help that? Our mouth, we want to think about things like fever blisters or thrush or a toothache, or what essential oils can go in there. What can we do to buy some time until we get to a dentist, perhaps, right? Our throat, one thing that we don't think about is a flashlight, a little pen light, right? So that if we need to see in the throat, have you ever tried to take a big old bulky cell phone and try to look in there, or a big flashlight? We want to have a small, kind of like a pen light, to look in there. And we want to have things for sore throat infection, not just things internally, but things we can do externally as well to protect our throat and our lungs. Some of the things in my kit are, something for a cough, shortness of breath, when to call the emergency police, ambulance, or, a nebulizer. What kind do we need to have? Our diffusers and syrups and all kinds of things. And when should we be concerned about a cough or shortness of breath? You know, if somebody's talking, they're breathing, right? I can't breathe and they're talking. And so we needed to be able to differentiate different types of things. A lot of times we think we're having serious lung issues, and really it's just mucus in our throat. And so you need an expert ear sometimes, or you just need someone to ask you the right questions, or maybe record a video and send it. And I'll be like, yeah, that sounds more throat or nasally, and they're coughing because they've got postnasal drip, right? And that's where someone who's used to listening to some things, because let's face it, when you're in a crisis, everything sounds really big, right? And if you got a partner partnering with you, mom back up, dad back up, then you've got somebody saying, I don't think it's that bad. Let's give it a few more minutes, and help you also be the best caretaker in that situation. Okay. Something we don't think about either is our heating and air conditioning filters. We need to be changing those once a month, you guys. I take and I spray my Young Living Thieves or my purification, or maybe I'll put other different smells with it, but I put that in my filter every Sunday. I go and I spray my filter, and then I put the date on my filter so I remember. And I also have it in my phone. So the first of every month I change my filter, I spray it down. Now, there are a lot of people who don't have a filter. They might have like an electrostatic or some other things. And you want to make sure that you're taking those out with your unit off and spraying those down, letting them dry before you put them back in on your unit. Another thing, if you are someone who's suffering a lot of allergies that I did not add on here, Haley, and we might want to add that if we can before that document is edited finally, is a UV light. And that may be something that you guys might benefit from, is putting that UV light on your heating and air conditioning, especially you guys down in Louisiana, Alabama, anyone who lives kind of around the coast, especially Florida with red tide. Those kinds of things can actually get into your system and recirculate. So that might be something, and you can get those very inexpensively. And even in some cases, you can DIY it. Okay. So if that's something you're looking for, reach out to me. I'll give you some more information on that. Let's think about heart. How many people have a blood pressure cuff? How many people have a watch with a second hand or a phone or something so they can get respirations and different things like that? What do you do, when you're waiting for the ambulance to get there, or the rescue squad, depending on what area you're in? People call them different things. It's still the same thing. Somebody coming to your house to help. Do you have aspirin on hand? Do you have something that you can get some relief? So this is when sometimes that these alternative medicines may not be optimal. If we think somebody's having a stroke or something else, we can pull out that aspirin, right? And we can give that to them very, very quickly. That's going to get in their system, and that's going to buy some time until that emergent care gets there to further assist, right? And you would want to make sure you told them that you gave them, 300 and some odd milligrams of aspirin, depending on what the circumstance is, right? And that's something else you would want to kind of know, like, in an emergency, I have this there, and you want to know where it's going to be. Okay. Also with your stomach, you want to have things for heartburn and reflux and pain and nausea. We don't need to run to the doctor in most cases for that. Baking soda, different things like that to kind of block things. And we'll talk like even things like apple cider vinegar and lemon. We'll talk about that as well with the stomach. Digestive, there's so many things that we can do. You want something for constipation and you want something for diarrhea. And, multiple things will do that. We'll talk about, what kinds of things and some suggestions in that category as well. When it comes to to skin, do you have a salve or a black salve that can do it? Do you have something when you have a suspicious irregular cell behavior topically? Do you know what to put on that so you can test the area to see what that is, or possibly even pull that out? Okay. Do you have something for a grease burn or sunburn? Do you have something for bleeding? Do you have something for poison ivy oak sumac? Do you have tweezers, right? I can't believe how many people don't have tweezers, but that's something to kind of think about, to have on hand as well. And specific. So when working with me, I want to know all kinds of things. What are your current issues? Do you have something that's reoccurring? Like every February something happens. What are the ages? We treat children differently than we treat elderly, and then we treat everybody in between. And sometimes we treat men differently than we treat women, just because we have to consider some hormones in there, right? Location, where are you in the world? What medications are you on? Do you have sensitivities? Do you have allergies? And so all of these things are going to be taken in consideration. And it's great when you have one person that's kind of looking at it like 30,000 miles up in the air, who's kind of like, helping look at all these different pieces and kind of going, okay, wait a minute, this and this should not go together. I mean, I catch so many contraindications with, a doctor puts them on this medicine, the doctor and another doctor puts them on that medicine, and the pharmacy didn't catch it, or they go to two different pharmacies to pick it up, or it's mail ordered. And so that's why it's nice also, if that is your demographic too, to kind of look at that in that. Okay. And even your race can have something to do with it too. I have seen that in a lot of cases where um, that can come into play. Sometimes we have to give other milligrams or less milligrams, and even food plays a part into it. So as an example, if somebody is from another country, they live there for 30 years, they come to America, they start having all these issues. One of the craziest remedies that I have ever given is I told somebody, okay, you've got this cholesterol and blood pressure issue, and it's technically because of your diet. They were raised in another country, and they were missing the seasonings and the spices of that ethnic food. And I said, let's try this. For 60 days, I want you to go to, we have a little market here that has like all the seasoning spices from each country, right? And so they could go in there and get those specific ones that were imported from their own country. And at the end of the 60 days, all his issues went away. He just needed to eat his ethnic spices and seasoning. So so that's some of the things that we look at too. Is sometimes we don't even throw things at you. It was not really a homeopathic. It was listening to the whole story. When did you get here? When did the conditions start happening? So sometimes it's even that. Excuse me. So when we talk about herbs, you guys, we want to, look at different things like echinacea and elderberry and garlic, but the specific kind of garlic, Allison, if you're going to do it in a capsule. And we would want you to have garlic as well, and cloves and astragalus, olive leaf, oregano, rose hips, comfrey, and catnip. We can do so many different things with this, right? And so in my world here, and if you are already working with me, you'll know that I don't really necessarily do elderberry syrup as much as I used to 10 years ago. And that's because I got into genetics, and I started watching the cytokine storms. I started watching what happened with COVID. And so really, I kind of go more towards a rose hip syrup. And when you get your document, there'll be like a little recipe link over there to the recipe that I personally use. And I use local honey to my area when I make that recipe. But that's just a personal preference for me, because when I'm recommending something, I want to be as close to, 99.9% sure that we're not going to have any sensitivity or reaction to it. Because if you're already having some allergies type symptoms and respiratory and shortness of breath, and I throw something at you and recommend it, and you have a cytokine storm, it's hard to differentiate, right? Whereas we think you're not getting better when actually you're having a reaction. So that's why I err sometimes on the side of caution. And I'll say, for right now, I don't want you to do any elderberry, because I don't want it to cover up some symptoms. And also in my world, change sometimes the remedy that we will use. So we give you a remedy, and then all of a sudden the symptom changes. We may change remedies too, or the way we approach that. So here are some things, there's this children's cold and flu, and, cold calm, Oscillo, different things like that. So Oscillo comes in this big 30 dose thing, but it's actually really tiny, you guys, like this, right? And so I'm going to give you a little tip. I don't even know how many pellets are in here, but it's a gazillion, it seems like. When you open this, you're going to open it very gently. And I tell people, open it over a paper plate or something, and open it really gently. And the directions say, take the whole vial. I've never taken a whole vial in my life, but take about 5, 7 out of here and use a whole vial all day long instead of one vial every couple hours, right? Because in homeopathy, a dose is a dose. So 5 or 6 of these little tiny pellets is the same as if you took the entire 30 vials at one time. It's not like in modern medicine where if you take one, it's 100 milligrams, you take 5, it's 500 milligrams. Doesn't work like that in homeopathy, okay? In homeopathy, a dose is a dose. One vial, 5 pellets, a whole box, it doesn't matter. It's a dose. And so save your pellets, have them go longer, take out 5, 7 of those in there, and that's enough to be a dose, okay? And you might also see different little homeopathics that come, boron, and you'll have some, you know, in green and different colors like that. They, you know, each one kind of means a little bit different things. You'll have different things in potency. So you'll see things on here, 30C, 12M, 6M. And as you build your confidence up, then you can go into homeopathic kits. We have some that look like this. This is a basic 36 kit. We have kits that are like first aid. We even have this one. Haley, you'll appreciate this one. This is a childbirth kit. So we even have kits for people who want to have support during childbirth for all kinds of things that can come up in there. And so we'll also have a link where you guys can purchase those. We also have a link where you can, in February, we're going to do a homeopathy one-on-one. And then as you get bigger, you know, if I could turn my screen around, you'll see I have thousands of homeopathics over here on the other wall, along with individual herbs and a whole wall of herbal tinctures that I'm making for different clients around the world. And so as you build this up, you become your own pharmacist basically, and you just go and make what you need to make, and you think ahead. Like sometimes these things you need to have for 6 weeks if you're going to be making, you know, different kinds of tinctures and other stuff. So, you know, one thing is nice is when you have somebody like me, you'll get a message, hey, it's November, it's time to start preparing for this, let's get our herbs out and make our tinctures, and this is how you do it, right? And so you need to, you know, have that and go, oh yeah, I need to do that, but not when you make it. But you know, if you need something, there's always a store around the corner, and there's Amazon and Full Script dispensary and things like that where we can get it in a day or two where the tincture's already made. And build up your community, because I know here we look on Facebook all the time. It's like, hey, I need this remedy. Who has it? A lot of times I have that because I have this big, massive homeopathic kit and dispensary with all the different potencies, because even the potencies do different things, right? So it's kind of great to kind of have resources too. And so I wanted to put this chart up here so you guys can kind of see that when you're talking to somebody who is homeopathic based, we're going to ask you, you know, is it cold or flu? Well, what if you don't know what the difference is? I'm going to show you about that in a second. And so I will tell you the first rule of thing is that the immediate onset of anything, you want to have aconite 30C on hand so that at any point in time, you have something that suddenly comes on aconite. I personally put bryonia with that. It covers 2 things at one time. You do them simultaneously together. If you have small children, you can use a spoon. You don't want to touch the outside of the homeopathic pellet because that's where the medicine is. And so you just put them on a paper towel, squish it with a spoon, scoop it up, put it in your baby's mouth or your child's mouth. They love it. It's kind of sweet, but aconite and bryonia is my go-to sudden onset of anything. And I'm talking anything. You fall down, you hurt yourself, aconite, bryonia. Suddenly you got this runny nose, aconite, bryonia. I can't breathe. So anything, it's across the board, no matter what it is. And sometimes that's enough for the body to go, okay, wait a minute. I'm going to pay attention. What's going on here? So then if it's a cold, then we go, is there a fever? Yes or no? Does it have symptoms? Is it streaming? Is it lumpy, you know? And so is the person weak? Are they drowsy? Are they this or that, right? And so this is kind of to give you a visual of in our head when we're asking these questions, is because we're kind of doing this in our head, doing that the little flow chart, right? Okay, if it's okay, then we're going to go and then we at the bottom, you know, eventually we're going to get to a remedy, right? And so you can see here a cold with a fever with no other symptoms, then that would be ferrum phosphate, right? Otherwise, we'll just keep going down the flow chart. But this is kind of what your homeopath, your naturopath is thinking in their head when they're asking you all the questions, right? And so here's some of the homeopathic kits that we have. We have first aid, it's traditionally in a 200. We even have a pet kit. So you can have that one that's very designed for your animals as well. So this is a good chart to have, you guys, because what is the difference? I don't know if it's a cold or flu. So here's kind of a chart that will be available to you guys to kind of say, okay, is it cold or is it flu symptoms? And this is the questions we're going to ask you to help differentiate, because we treat them both differently. Okay. Again, we're looking at symptoms, not necessarily a label. And so, a lot of times we'll use, oh, they have the flu, or oh, they have a cold, when really it's the reverse. Or because sometimes it could be neither. So here's an example of a cough, right? I wanted to kind of give you guys a little more, because homeopathics is kind of a little more foreign. Everybody's heard of, herbs and tinctures, but homeopathy, people are still kind of like, I don't know, I don't understand how that, and what does it work, and why are you asking me 20 million questions? So, is the person gagging, like gagging, like choking on their saliva? Are they, you know, um, waking up between midnight and 4 a.m.? Is it worse in the morning? Does hot make it better? Does cold make it worse? Is it worse when they're laying down? Is it worse when they're up? Does it sound like a dog barking, right? And so this is why it's really interesting. I just wanted you to kind of see how, when we're looking at this, how the different remedies would be different and how we would treat that, right? Sometimes it's a 30, but for a gagging, we're going to go more strength, and we're going to give you a 200 for that one, because that can cause a baby to choke, right? And so we need to get that gone quickly. So different things will work with different stuff. So when we come to teas, we all love tea, right? Put a little anise in there, some cinnamon and lemon, or ginger, and different things like that. Slippery elm, lemon balm. If tea's not your thing, you can make this hot, you can make this cold. And sometimes it is specific. We'll say, hey, we need that to be warm. I know you really don't like warm tea, but we really need that to be warm. Or sometimes we'll say, hey, we need that to be cold. Because think about what hot and cold does, right? It opens up the pores, it closes down the pores, depending on what we're trying to do. And that's why sometimes we'll say, sometimes it's warm, sometimes it's cold. So here's some herbals. Like I said before, I kind of stay away from elderberry unless I know your genetics. And if I do have your genetics on file and I don't see that predisposition, then I'm going to give you elderberry all day long. Rose hips, just because elderberry is easy to get, it's all over the place. It's hard to, rose hips, you got to make it. It only takes a couple hours for that. Or ginger lemon balm, fire cider, that takes a while because it has to steep for 6 weeks. So there's different options, right? We got something we can get today. We got something we can make for later. And we got something that'll be, ready. We can start in the beginning of November, and we'll have it all season long. Okay. So when it comes to our nebulizers, and specifically like pneumonia, I have some very, very specific things that I want you guys to get for this. So when you're looking at your nebulizer, in the list, we gave you 2 ideas. You don't have to get it from that link, but you're going to get the idea of it. Okay. So one is you want to have a mask. Okay. And the reason is we can, it's got the dispenser here. You open it up, you put your stuff in, you close it up. But when we're treating things, we're not just treating the mouth, right? And how many people can't inhale, right? Like I could never smoke a cigarette. I can't inhale. I can't do any of that kind of stuff. So I wouldn't be getting anything in there. Okay. So you want the mask, especially for children. You can hold it there. They can breathe it in, or for adults. And part of what we're treating too is the sinus cavity, right? And when you're breathing things in, you're even getting the backside of the ear. So we're getting all of this at one time. And that's why you want to have this mask, right? So it covers everything, and you want to have it in an adult size, and you want to have it in a child size. Okay. And then it's going to have a cord. It's going to be to a box, and that's going to be plugs into an outlet, right? But if you're traveling or you have something you're susceptible, they also make one like this that's portable. Make sure you have extra batteries with you, or if it's rechargeable, make sure it stays charged, or it has a plug that would go into maybe the cigarette lighter. So you want to have both of those if you have a circumstance where you have respiratory needs for your family, but at least having the one at home is really important. Now, when it comes to inhalants, I'm very specific, okay? There are only a very few things that I trust. So silver, right? You want to have a good brand of colloidal silver. And traditionally, we're going to do about 1 teaspoon. You're going to put it in your little container. And then I'm going to go to a lobelia essence. And this is from Nature's Sunshine. And I trust that lobelia and Herb Farms lobelia. I trust that. And 1 to 2 drops, 1 drop for children that are really young, and you're only even going to do a half of a treatment, right? And so that's when you have your naturopath who's going to say, okay, you're going to do this combination, 1 teaspoon, 1 of silver, 1 drop of lobelia, and you're only going to do half of the treatment for someone under 2. Then from 2 to 10, then you could probably do a 1-to-1, like 1 teaspoon to 1 drop. This is not the case to do and I'm going to try to be funny, is the man syndrome, right? Where the man's like, oh, if 2's good, I'm going to take 4. This is not the time to do that. When we tell you lobelia is not something to play around with, but it is something that you definitely need to have in your medicine cabinet because it will expel things out. And sometimes we'll have you put lobelia and capsicum if we think you've got a food poisoning, we need to induce vomiting. If that's something that, comes up, or somebody has swallowed something that they shouldn't have. So there's all kinds of different things where somebody has a lot of mucus in their lungs. Lobelia is going to be your go-to topically, and it's going to drain out those lungs, and then it's going to dump it into the stomach. The person then probably is going to have an upset stomach because all that mucus now has come into the stomach. So that's where you're going to want to have like your Young Living Digest or your Tummy Gies and different things like that. You need to know the cascading effect that could do, or your enzymes, right? So we can gobble that up. And one of the things that I did not put on here is Young Living has Essential Zymes 4, okay? Not just the Essential Zyme, but the Essential Zymes 4. That's the very specific one. I love that product. It has different strains of proteases, has all kinds of other things in there, bromelain, papain, different things like that that are anti-inflammatory. And we will use that product for all kinds of things, right? We'll use it to help gobble up things in the stomach. We'll use it for if somebody's in extreme pain, I'll give you 5 or 6 of them because of the ingredients. Forget that it's a digestive enzyme because it has a lot of other purposes that not necessarily they can tell you about. Another thing I like is Nature's Sunshine has a papaya mint. That's great. It's a chewable. And so you can break that off, give your kid a little piece of that, and it kind of calms the system down. That papaya helps digest and that mint helps cool. And then like if you have pneumonia, some of the things you want to do is definitely try to get your raindrop, find somebody who knows how to do the raindrop. It comes in a kit from Young Living, and it will tell you instructions in there. Things that you might want to have is Artemisia, which is also wormwood. DHEA sometimes will help with pneumonia depending on the circumstance. So, when we have you have a couple of things on hand, you're like, why do we have that, right? And so that's when knowing what to have for your specific family instead of going out and spending, $2,000 by buying all the stuff that you might not ever use or might not ever need, right? So, when we're talking about essential oils, these are really low dose botanicals, you guys. We want to be careful that we are using them safely. I know Haley does a lot of classes on that. I know that if you're in her Young Living downline, there are tons of resources in the Facebook group, and she has a lot of documents in there that will tell you like when you use this, how to use that, what about ingesting, what's the safety concerns and things like that. I personally would, ingest, essential oils, but that may be a concern that you may not want to. So that's when you work with your provider to kind of know things. So just to kind of let you guys know, a drop of peppermint is 20 cups of herbal tea with peppermint leaf, right? That's how potent these things are. And they're fantastic. Okay. But we also need to make sure that we're using them properly. So some of the essential oils that I have that I keep around the house and that I know Haley uses as well is the Kid Sense. I love it. Lily is 10. She still uses her essential oils every single day almost. She's like, oh, I got a boo-boo, or oh, I need this, or oh, I need to go to sleep, or my tummy's upset because, sometimes I'll catch her and she's got her bottle and she's like, oh, this just smells so good. And so we teach our children from a very young age on how to use these things themselves, and they'll just go get them, right? They'll know what color goes for what, right? And just go, oh, go get the yellow one, go get the gold one, go get the blue one. And so we teach them how to be, their own little doctor. And next thing you know, they'll have something and they'll be using it. Raindrop is really great. Lavender essential oil is a must for, I think, every single person needs a bottle of lavender. Thyme, peppermint, depending on what's kind of going on, or some other great ones too. And, here's some more things. And there's blends. There's tons of blends with Young Living and things like that. And so this isn't a complete list. And, a lot of the oils do need to be diluted in some cases. So make sure you kind of know that. Okay. Oils on the go. Did you guys know you got things, you can plug into your computer, you got things for your kids, the little owl plays music. It's really like a nightlight, and then you got the little turtle, and then you've got all kinds of things, some in your car. So we have tons of options when it comes to like diffusing and keeping our environment safe around us and healthy. A couple of things we don't necessarily think about is like, these little diffuser necklaces, they have a little pad on the inside. So you open it up, you can put your little oils there, you wear your necklace. So it's kind of, protecting the air around you. So that's a great thing. We have bracelets that have lava on them, and you can put essential oils on those as well. So topical, some things that we want to have are things like peppermint, eucalyptus. Lavender is excellent if you get a burn. Tea tree is really great if you've got a boo-boo or something like that. And, one that I didn't put here just because it's so expensive, and, it's really kind of up to you guys, but helichrysum. And I'll tell you, helichrysum is a lifesaver. I don't know if you guys saw several years ago, my turkey had a mating injury, and the whole side of her, the big 75-pound turkey tried to mate my 20-pound turkey, and it just filleted her side open when he did that. And she literally was, wide open. But anyway, I did not know what to do in the moment. I had never experienced that, but I did know I had helichrysum oil, and I knew that that would immediately stop the bleeding, right? And so I literally took this $80 bottle of helichrysum, and I'm dumping it on this turkey, trying to get the blood to stop so I could get her. I had nothing else at home for her, you guys, right? I gave her some arnica homeopathic. I got the helichrysum, the bleeding stopped. I wrapped her up and got in the car to the emergency vet. By the time I got there, I got yelled at because the doctor was like, "What did you do?" And I said, and I said, "Well, I put helichrysum essential oil on her." And she's like, "Never do that again." And I'm like, "But why?" She said, "Well, I'm going to have a hard time kind of sewing this up, and I don't know if it's healing correctly because the skin had already started healing." And she was more upset because she couldn't see underneath of it, and she was afraid that maybe there was some internal damage, but the helichrysum had already started healing and fusing the skin back together. And so I'm like, "Yes, that's a win, right?" And she's like, "You got lucky." And so anyway, she stitches her up, and she's like, "Okay, I might have been a little too much, but that was some fantastic stuff. What was the stuff you used again?" And so, she had turned around by the time she got the turkey into surgery, and she actually kind of looked at it, and she kind of came back and ate some crow. But it's a testimonial to how fast we're talking. 45 to 50 minutes from the time that I found the turkey to the time I was at the hospital, that helichrysum had already started doing that. So these oils are very powerful, and when you know how to use them, they do amazing things, right? And combinations of things too. So here's some other things to have on hand. Don't come after me for the melatonin. I'm not using, nor have I ever used, and nor would I ever use melatonin to help someone, especially a child, sleep, right? As routine, that would be kind of a last resort if we had to for a day or two, right? But we use melatonin sometimes for severe viruses. So for instance, in COVID, we use melatonin as a last resort to kind of knock a couple things out. So that would be something that we had on hand that we used in certain scenarios, right? But we would not be using it for 6 months. So because we want to get our children to sleep, right? We've got things like Coffea homeopathic, and we've got Nux vomica homeopathic, things like that that would be much safer, that we could use for sleeping issues, right? And sleeping concerns, instead of, hey, let's give this melatonin to force them to sleep, is not always optimal. Okay. things like vitamin A, C, D3, K2, quercetin, NAC, X-Clear. I don't know if you guys have ever seen that. This is what X-Clear looks like. It comes in two kinds. One's a rescue that has essential oils in it, or you can do this and add your own essential oils into it if you want to. We also have this thing called Cofix RX. This is a iodine spray, and it really got popular back during COVID for viruses, and you can do that now. It's amazing. It will stop things in its tracks, and the X-Clear as well will do that. So there's different options for that. And I'll show you some other little things here in just a second. So here's kind of like a little short list, right? You want to have, a lot of these things you would definitely want to have. A lot of us probably have a lot of these things already. One of the things that is so simple and it may not always be accessible, especially now, a lot of the stores are closing. We don't have a lot of 24-hour stores where we can get just some simple things that are open anymore, but garlic and onion. And I know that I tell you, hey, when you cut an onion, you need to use it or throw it away because it will start gobbling up bacteria that's in your environment, right? So you don't want to necessarily have that onion be able to be exposed to things because then when you eat it, you're actually eating other bacteria. So I want you to slice up some onion and I want you to get some things of garlic. I want you to get some ginger that's in a root and I want you to put it in Ziploc baggies and I want you to put it in your freezer, right? And I want the onions sliced. So you're going to slice up your onions and you're going to put them in different layers in there in your Ziploc baggie. So when you need that, it's already cut because it's hard to cut, let's face it, a frozen onion, right? So already get it, flash freeze it. So get a cookie sheet out, slice your onion, stick that in the freezer for 2 hours. It's going to flash freeze that. Then you put that in your Ziploc baggie so that when you do need it, that you can have that. I also want you to get a bag of white rice. And I want you to put a big black X on that bag, or I want you to put it somewhere because we're going to reuse that. You get something, you got an injury, you have something, we can heat that rice up and we can cool that rice down, right? So I want you to have one bag in your freezer in case you need it for a headache or an injury, or a bag of peas. I want you to have some rice that you can put in the microwave, right? If you're going to use that microwave, or you can heat it up in the oven. You can put that in a sock and you can put that on your body somewhere if you need to do that. So we have all kinds of little things we have, but we're going to have some of those things in our home, right? So get yourself some onions so that when you need it, you can do the onion with the garlic. You can squish that down a little bit. You can put that in a sock and put that on your child's foot at night. You can put a half an onion next to your bed. And, if you've got pneumonia, it will help, contain that so it's not going around. There's all these little home remedies that, we can do. So we have tons of little ideas for you guys that we possibly cannot cover in the short amount of time that we have tonight. Also, sometimes we use over-the-counter stuff. There is a virus going around right now that Dayquil and NyQuil, although they have dyes in them, but sometimes in a pinch, if you don't have anything, Dayquil and NyQuil will be your go-to. They will expectorant, they will do things. It has alcohol in there, and sometimes people need to have that little bit to calm things down. But if you're going to get something over the counter, you want to have things like Dimetap, but get the dye-free kind. So anytime you can get something, get it dye-free, right? And sometimes you just can't. So make sure if you have allergies or something, Tylenol, different things like that. If that's going to, I don't use Tylenol per se, but you're going to have some of these over the counter because what happens? It's 3 a.m. and you don't want to go to the emergency room and you got a fever and you get scared and, you just need something to take the edge off. I let a fever go. I'm not going to tell you the number I let a fever go to because you may not be comfortable to that, but I let it get up there because that's your body's way of heating up the body. You definitely don't want to treat a 99 and a 100 fever. You just don't want to because you're kind of, making yourself suffer a little bit longer than necessary. So let that fever go a little bit, okay? And that's where working with someone, you guys can discuss that and figure out what that number is before you would want to give something that's dye-free to perhaps bring that down in an attempt to avoid an urgent care or an emergency room. So if you wanted to go the prescription route, And I did put on the document, these are some of the things that some people have had some benefit from, especially back in COVID, ivermectin, hydroxychloroquine, Z-Pak, steroid pack, nasal sprays, and different things like that that can be in a prescription pack. If you are my client, or if you want to be working with me or something like that, these are things that we can get for you. But you do have to have a relationship with me for me to help you get those. And so if that is a route that you want to go to, we just want to make sure in this presentation that we don't just kind of just say it has to be this way. There's tons of options out there, you guys. I work with everybody. When I tell you I'm practical, I have people that come to me and say, I don't want any of that homeopathy. I don't want any of that herbs. I just want to be able to go, to my pharmacy and get whatever I want over the counter. I want to be able to order it from Amazon. I work with everyone. I don't judge you. It's your life. You get to make a choice, And so I work with all kinds of people. So I just like to make sure I put that in there in case that is you. And you want to have that option as well. Also, there's things, that you can get for flu and colds and other things like Tamiflu. So that's just some things, if that's something you want to do. Air quality is really, really important, making sure even in your car that you're changing those filters, and you can use, a dehumidifier, humidifier. We use them for different things. You want to make sure you're cleaning them. If we were all on this and we could all talk to each other, I would ask you, when was the last time you cleaned your diffuser? And that is something that I also put on my calendar, just like with my air filters, is to clean them, because it's so easy to forget about it and not actually clean them. And one day you're like, oh my gosh, when was the last time? It's been 5 years, right? It's going to help your diffuser work better. It's going to help it be more optimal. And it's going to keep any kind of bacteria or anything from accumulating in there just from the moisture, right? So make sure you're cleaning those diffusers. If you don't know how to, there's tons of videos out there. I don't know if Haley has one out there, but I'm sure she could tell you how to do it. It's pretty simple. Home remedies, we kind of talked about most of these, a steam shower, you want to have be able to garlic with salt water. You want to make sure that you can rest. I mean, some people even do the hot toddies, right? You put a little whiskey in a little shot glass, warm that bad boy up, put a little honey and some lemon in there and shoot it down and go to bed with your heating pad. I mean, some of these home remedies actually work. I have a whole book about this big, and I've tried some of the little crazy home remedies that have been in there. And it's really amazing about, what they had to do back in the early 1800s and 1850s and, things like that they did. And I'm like, wow, I never thought about that. But I've tried a couple and they've actually kind of worked. So let's think about emotional. So a lot of times we don't think about emotions affecting our health, and they do. So there's things, different essential oils and raindrops and herbs and Bach flowers and homeopathics. And if need be, a suicide line, you guys, please, if that is something that you are struggling with and you're considering suicide, or you're just getting really, really depressed, please, please call someone. Please don't make a permanent decision for a temporary problem. There's tons of people out here who would love to help you. We'd come get you, we'll get you the help. There's mobile crisis. So I just want to make sure we do touch on that. That is something that's often left out when we're talking about health, is the mental side of that. Also, basic first aid. There's a lot of free classes in your community and a CPR class. So that might be something to kind of think about that we don't necessarily always think about. So some of the tools that I have not talked about real quick is a pulse ox. We talked about that on the slide, but it's really simple for you guys who don't know it. It will tell you what your oxygenation level is, and it puts on. Now there's several kinds, and I have two. I have this one, which requires me to be sitting there looking at it. And then there's this one. So if you have a baby and you're concerned about what's going on, you can have it hook up to your phone and have it be on like your baby's foot, put a sock over them, and you can kind of see what's going on. So there's that option, and that allows it. There's also some little devices. If you're interested in anything I'm talking about, just shoot me an email. This one is a little infrared nasal cannula, and it goes up your nose. You take the little things off and it shoots up infrared red light, and it will address any kind of sinus problems, any kind of chronic issues, or the first sign that you're getting sick. And it just plugs into a little device and it goes up your nose. We have some just like this they can do for your ear, and we have one that you can put in your mouth to treat your throat as well. So even some of these cool little devices that we have. Also, you can make your own homemade nasal sprays. So you just buy the little thing, you put what you want in there, and you may have your own nasal spray. And this is one a lot of people haven't seen. This is one, has a little thing on it, and then it turns up. You can do it, make your own throat spray. And so it's that you open it up and you can spray that. You can make one for, and I like these because I can make one for every person in my family if need be, and I can put their name on it. A lot of times we don't think about when we have a first aid kit, but one of the things you want to have is a butterfly closure. So if you have a big gaping wound, you can help close that together. So that's something you want to make sure that you have too in your kit. And I think I've covered everything else that I have on my desk here. So here is my contact information, you guys. Haley's going to send all this out to you as well. So don't worry about having, if you don't have a pen or something, it is on your document. So Haley, I let you, there you go. Whew, we got through it.
Thank you, Dr. Tonya. Do you guys want to clap?
Yeah. Can you hear that? We said incredible.
Thank you, thank you. Okay, I don't know what time it is. Do you have a moment? for a question?
9:07.
Awesome.
It's
Anyone have a-
8:07 your time.
Don't hold back. Oh, it's not really. One of my big takeaways was super simple, but to have frozen, cut up, onion, garlic, ginger. These are like things that you could just use in a pinch. What are the other things she said are for you?
I think one of my biggest takeaways. Hi, Tonya. My name's Louise.
Oh, here.
Can she hear me?
Tonya, can
I
you hear
can.
Louise?
Is doing natural health in community, especially if you have little ones. So I've been doing this for about 10 to 15 years. And once I got into a community, it really boosted up my confidence level because my husband wasn't really on the same page as me, but I had to have confident moms around me, like my friend Jessica, Haley, and actually a long time ago, Jess, it was oldest sister, Harmony. Harmony actually called me 10 years ago and talked me off the ledge about steamy showers. Get that kid in a steamy shower, and I have never done it. I was really nervous. So anyway, I digress. Just doing it in community can be, it can be vital for some moms. Some moms are already
And it's a necessity because, when you're in the trenches and let's face it, you're sitting there just trying to help your child and you can't think because you're in that crisis. And so if you've got that lifeline or you got somebody else who can just come in, kind of take charge and say, hey, I got your back. Let's do this. Let's do that. And you can bounce things off of, and they have a different experience. And it's so necessary. And, and that is also part of our toolkit and what if we don't have something? Can we go to a neighbor or can we find a resource, right? And so sometimes, I've had people where they've kind of divvied things up. They all went together, they bought a whole bunch of stuff, and then they split it between 3 people. So that's also a great idea, is to get a bunch of people together, because let's face it, we might not need 120 capsules of something, and we might not use them for the next 5 years, but maybe 40 per 3 people would use them, right? And then it would make it more cost effective and everybody can get, their medicine cabinet built up.
Yeah, that's good. That's true. Tonya, that was amazing. So much wonderful, helpful information. Also like the go-to homeopathic, she remembers those too. On the onset of symptoms. Aconite.
One story with an A.
Embryonia.
Okay.
Yeah.
Aconite.
Embryonia.
Or she linked a lot of those things, and that stock list, you guys can't see my screen, right? They're looking at my screen.
We can see
that. You can see what I'm showing?
The stock list,
Oh.
with you also.
Oh.
Yeah.
Bernice.
Yeah, I can see you and the baby.
Oh, but can you see the slide I'm showing? I don't think so.
Oh, no, I can't see the slide, no.
I'm gonna put in the chat one more time in case of
Here, I just made you host, Haley. There you go. You're host again.
There you go. Tanya linked in this stock list though for you guys, everything from the homeopathic kit to the nebulizer to the pulse ox, the small flashlight, like all of that stuff. So incredibly helpful. Thank you so much.
Having a nebulizer too.
And you know,
Yeah.
and in that document, there is a link for full script. And what I did was I went in there and I don't know, I think there's like 70 products. So when you click that link to full script, it's going to ask you to put in like almost like create an account. And so when you do that, you're going to see that there's like 60 different things. So you don't need everything that's in that cart because there might be a liquid form and a capsule form and a spray form, right? Of the same exact product. And I might have a child one and an adult one. So just take your time and kind of go through there. But it's kind of my go-tos when we're talking about what to get. And so, you know, when you got a dispensary that has 20,000 products, which Mullen do you need or which brand do you need? So I try to put all of that stuff in that full script. And so you can just kind of go through there if that's something that you want to get. For the next 2.5 weeks, you guys get free shipping over $50 and 15% off your order. So you've got different options. If you want to know what to get, send me an email and say, hey, I don't know what to get. And then include, you know, I have children, I have this, what are their ages, what medical conditions, what do they have? Give me some information. I'll say, okay, I would start with these 5 things. This is the basic, right? We gave you list of the nebulizers. We gave you one for home. We gave you one that is portable. I always like the home ones that plug in. So think about it. If it plugs into the wall outlet, it's more powerful. It's meant to be your everyday, more intense version, whereas anything that's portable, you're not going to get exactly what you need. And Haley also did one that was a mister for children, which is great as well. So we put that in there. That's at Target. You can do it, drive up and pick that up. Haley's going to show us something.
Oh, I have like my ottoman has a bunch of my remedies that I just keep around the house, but I was showing everyone just how small the nebulizer is, but it's got where you can attach the mask to it. Thank you for the recipe. She put a recipe tonight in the notes for pneumonia, which is different than just like the generic, what you put in here. I typically do colloidal silver and iodine. This is the little on the go one that is great for travel or babies. You just, do you guys see that?
What is that, David?
This is just a saline. It's called Boogie Micromist Saline Inhaler, and it's from, I got it from Target, but I keep these on hand too. I've already used it on Jude before, and then I've just got a basket, but I think you've mentioned pretty much everything in these tonight. These were just some of my, like, I have the homeopathic you mentioned, which you gave a whole different protocol because this does say to dissolve an entire tube at once. So you break it up.
Save that. And the other thing, we're talking about iodine, you know, Providone iodine, you guys, you can get them in a swab. And have you seen those people on TikTok and Instagram? They're painting their throat with the iodine. It works because that's the same ingredient that is in your Covix, the snow spray, is Providone iodine. So go get yourself some of those swabs. And I put the link in there and you just paint your throat. You literally down both sides and 3 swipes across, and you would do it at nighttime. You go to bed, it stains, so be careful. Let it, you know, kind of waft it a little bit and let it dry. I'm telling you, overnight, you got a cold sore, put a little bit of that Providone iodine on a cold sore fever blister at nighttime. You got genital herpes, put that Providone iodine on that at nighttime, go to bed the next morning, it'd be almost dried up. So there's so many different uses for even that. You get a cut, you can use it, right? So there's a couple of extra little tips.
Something that I do anytime my kids have snot, even if it's clear, so Jude, because he's teething, he has a lot of this, I just preventatively do garlic drops in the ear because I know when they're steam, that's gonna drip into their ears. Did you pull up her link from her link?
Iodine swab.
She put it in the list.
Yeah. And Michelle said in the chat, Michelle said that she used it on a cut for a diabetic's foot, and it healed that foot in 3 days using that povidone iodine. So that's also something, you know, that you can use it on wounds along with like helichrysum if it's bleeding, and lavender for a burn. I mean, it's fantastic. I wish I would have had the pictures, because I had somebody, the only essential oil she had was Young Living's lavender, and she burned herself and dropped some hot coffee on there. And let me tell you, I had her doing it, you know, with the cold water for 20 minutes. Then we put the lavender on there. She rubbed it in, and then we had her do more cold water. And within 6 hours, it looked like she, you know, besides 1 or 2 little tiny blisters that had shrunk, the whole arm was completely healed up. It's amazing what these, you know, oils will do if you have what you need and know how to use them, or have a resource, you know, to call, right? She knew that she didn't know what to do, and so she called the only person, because it was either 911 or me. I happened to answer. She had what she needed, right? And that's also a big thing, is to have what you need on hand.
You know, my big factory's wedding, and they spray Windex on everything. You know what that's lavender. Lavender or
Everything, just put it on everything, right?
Great. Hydrogen peroxide in the nebulizer.
What do you think, Tonya, about iodine and food grade hydrogen peroxide in a nebulizer?
Oh gosh, are we still recording? I personally, based on an incident that happened here during COVID, I cannot do that, nor would I ever recommend it, because they did not use it correctly. They did not use it under guidelines. They didn't have the right peroxide. There was all this, and the little child really got hurt. Okay. And so for those reasons, it's not something I'm going to advocate for, when I have such safer options out there with my silver and even the iodine or lobelia, and, you know, making sure people understand, because there's just so many different peroxides out there. And so that's just my personal thing. I have not ever used it, and I probably would not ever personally recommend it, but there are a lot of people out there who have had great success with that, and people have used it safely.
Thank you. Anybody else have a question?
Ask her what the L one was for the nebulizer.
The L one?
The L word.
The L word.
The one that played lady.
What
Lobelia?
did you? Oh, lobelia. That, I thought that was a homeopathic.
I'm trying to find it on here.
Okay.
This is a lobelia essence, and Nature Sunshine makes 2 lobelias. One is a lobelia that's a capsule. We don't use that. We use the lobelia essence, and that can be used topically when you cannot use it internally because of the age of a child or the circumstance. So you can actually put 3 or 4 drops externally and rub that on the external, let it soak in. That helps with like pneumonia, respiratory, and things like that. But anytime you do lobelia internally, you will never ever use more than 1 to 2 drops, not droppers, but drops. This stuff is potent, and you probably will never use this whole thing in a lifetime.
Somebody asked if they already have a full script account, will that link still pop in there?
It will.
Awesome, thank
They
you
just
for
have to
that.
just go into their full script. If they're logged in, log out, and then come into mine. They'll still have to create an account to see that. And if for some reason it doesn't work, email me and I'll send you the list.
I have a room full of oil users in here. I'm sure we could all go around with helichrysum testimonies, but I do want to just attest that it is worth every penny. That oil is
so
worth
worth
every
it.
penny. You need it, you only use 1 or 2 drops at a time. I take it to birth with me. It's always going to be in my birth bag. It's pretty miraculous. All right. We could ask 2 questions all night, but thank you so much for your time and your wisdom. You guys all hopefully got the QR code, or you texted in. I'm probably going to send a follow-up text tomorrow, and make sure that you have Tonya's information. She shared with you her email and her website, which is tonyanichols.com, right?
Yes.
If you want to get,
And if you guys
okay.
have any questions or anything like that, feel free to email me. Tomorrow is Tuesday. It's homeschool day, and I might not get back to you until Wednesday. So please be patient. If for some reason you do have an emergency or urgent question, when you send an email to me or you text that number, please put the very first word, important, urgent, emergency, with something to get my attention. Because, you know, when you get your phone, you kind of get that first little, 2 or 3 words. So if for some reason anybody needs something, please make sure you get my attention. If not, I'm going to roll you over and I'll get you on Wednesday morning when I get back to the office. Okay. So be patient because I'm homeschooling tomorrow.
Okay.
Thank you.
Thank you.
Thank
Thank
you.
you.
Thank you.
We love you. Have a great
Bye.
one.
Thanks.
All right. Bye.